China says it will donate 2 billion doses of COVID-19 vaccines within the year. The announcement by Chinese President Xi Jinping was made in the International Forum on COVID-19 Vaccine Cooperation. He also promised to donate $100 million to the COVAX Global Vaccine Distribution Scheme. Let's talk now to Professor Beate Kampmann, who is Director of the Vaccine Centre at the London School of Hygiene and Tropical Medicine. She joins us from Banjul in Gambia. Thanks very much indeed for being with us today. So how much difference will these moves by China to donate vaccines and money make?
Well, it is a really welcome move because there is still huge inequity in the vaccine supply globally, with only about 3.5% of people being vaccinated, for example, in Africa, where I'm currently based, and overall low-income countries having less than 2% vaccine coverage. And we really need more vaccines donated, and we need dollars to populate the COVAX initiative as well. So a very welcome move indeed.
Meanwhile, we've had the WHO calling for a moratorium on booster jabs so that the rest of the world can catch up and get vaccinated. Would you support that strategy?
So there was a very clear message from Tedros on Wednesday around trying to achieve at least the target of 10% of the most vulnerable vaccinated in all countries by September, and not to give booster vaccines globally in countries where there is a surplus of vaccines. So I think the science around the need for booster vaccines is not yet completed. And while some countries feel that the most vulnerable in their communities should have a booster, I think we should really look at the data, and it will completely depend on the epidemiology in those countries as well. So I strongly support that we increase the coverage globally before we go for boosters.
Does it have to be a choice, though? Can't boosters potentially continue alongside further doses?
Of course, yes. But, there's only so much vaccine going around, and one thing does not exclude another. But countries really need to continue the international collaboration to make sure that the vaccines are available to those in countries who have not yet had the opportunity to be vaccinated, and where we still see death and, really erosion of healthcare systems who can't cope with new infections.
So how important is it for the global fight against coronavirus that no country is left behind?
It's a very important message to keep reminding ourselves. No country should be left behind. The goal of cutting transmission of the coronavirus is really quite a way off with the targets globally, but at least we should make sure that people don't die unnecessarily and that already very stretched healthcare systems are not completely overwhelmed. And the international efforts need to be continued. This isn't done, and we need to step up in vaccine delivery internationally, which is happening, but it's not yet sufficient.
So what are the main challenges for developing countries in trying to get their citizens vaccinated?
I think the supply situation isn't yet solved. The African Union has a very wonderful website which shows us where the vaccines have been administered. There are logistics challenges, there are financial challenges, there are challenges of manufacturing, of having enough product out on the market. And they're also, challenging on the ground to give vaccines that are new to a program in a pandemic situation when there are already challenges in delivering life-saving childhood vaccines. So there's only so much people can do. And it is very much a question of all hands on deck, but it does need international support.
So what would you like to see richer countries doing to improve access to vaccines?
I think the pledges that have been made both by the G20, now also by China, they are hugely helpful. And the COVAX initiative is the cornerstone of delivering these vaccines. I think we need to have the commitment from companies also to donate and keep the prices achievable for low and middle income countries so that we can roll out. And ultimately, we need to upscale manufacturing globally. And that is a more long-term vision, because vaccine companies cannot be, established overnight in countries that haven't produced vaccines before.